right, here we go, and we'll finish this out. So you're enrolled in a health plan with the medical trust, and you know that you have health care coverage, and you know that you have a prescription coverage, all those things that come along with that. But it's always great to be reminded of what else you get, what else comes in the box of benefits. And this is where we go here, it's called beyond the basics. Additional benefits, or those value-added benefits that CPG offers with all of the health plans, or all the health plan enrollments, include a vision care program through IMED, an employee assistance program, a service we call Health Advocate, and a hearing care program with Amplifon, and a travel assistance program through United Healthcare's Global Assistance program. We'll get into each one of those here. IMED Vision Care, you're eligible for an annual eye exam with zero copay when you're using the network providers. You can see here offers discounts as well, including discounted pricing for surgical procedures such as LASIK, discounts on frames and contacts, as long as you're using the in-network services for those. So a great vision care provider with IMED. What was the previous name? Do you remember, Andrea?
I'm at Superior Vision.
Oh, okay, yeah. The Employee Assistance Program. This is a counseling service. It can be many things, but it's free, confidential counseling service. Very much in many cases at no cost. We'll get into that on the next slide. This is administered by Cigna Behavioral Health, available to all members of the plan and their household members, regardless of the coverage. So if you have single coverage and you have dependents who you don't love enough to provide health care for, no, just an example. Anyone in the household is eligible to take advantage of the Employee Assistance Program. And their services are available 24 hours a day, 7 days a week, and they use professional consultation clinicians, or consulting clinicians. This here, as we get into, as I mentioned, very little or no cost. Included with all medical trust plans, as we mentioned, zero member copay. And this tip here that we have, you would use could use the EAP, the Employee Assistance Program, before using a mental health or substance abuse benefits to save the copay that would come along with those. The service provides up to 10 face-to-face counseling sessions per issue at zero copay, and members can receive treatment for the same issue that they're working on multiple occasions each year. And over the telephone, Employee Assistance Program has telephone consultants, again, 24/7, available all the time, unlimited, at no cost, telephone counseling sessions. Employee Assistance Program goes beyond the behavioral health or counseling as well. They offer advice on legal and financial services, child care, so if you're looking for a daycare facility in your area, those sorts of things, elder care, pet care, identity theft and fraud assistance. You know, what don't they do? Extensive online resources, also very helpful, looking for relocation advice, among other things. There's a lot of interactive tools that they provide as well online. Again, this slideshow will be available on the Diocesan website, and of course the video that we're recording here, so that you can remember to look into this more. Because again, these are all the benefits that come along with your health care coverage that sometimes it's difficult to remember, these extra things that we have right at our fingertips for little or no cost. Which also brings me to Health Advocate. This is another counseling service, but specific to the healthcare side. They offer private confidential assistance for your healthcare concerns. So if you have questions, I like to look at Health Advocate as that complimentary second opinion. Always here, get a second opinion when you have something that you want to know more, that the doctor said this, and get a second opinion. Well, Health Advocate is there They're staffed with nurses and other, here, typically a registered nurse with considerable experience, the average of 10 years experience in the medical delivery system, and you have a personal one-on-one contact at Health Advocate that you can remain in touch with, that one individual. And eligibility for Health Advocate, active and retired members of the Medical Trust, members' spouses, dependent children, members' parents, and parents-in-law. So it goes across the extended family. More about what your Health Advocate contact can do for you. So I mentioned some of these. They can also schedule specialized treatment and tests for certain conditions. Work with insurers, the insurance providers, to obtain approvals for needed services. I've had a few questions come my way that Health Advocate has been able to step in ways that, again, we do a lot at CPG to help out our members, but Health Advocate, the reason we provide this is there's extra steps that they can take in working out perhaps a certain approval for a certain procedure to take place. What else can Health Advocate do here? We can assist with elder care and related health care issues, arrange for home care equipment after discharge from a hospital, very important there. And the next value-added benefit, as I mentioned, we have a travel assistance program provided through United Healthcare. Their global assistance provides 24/7 emergency medical advocacy. I travel a lot. I haven't had a situation yet, and I say yet because I do travel a lot, where I've needed some advice from this benefit, but it's a wonderful benefit to have. They have multilingual coordinators that can help you get set up with referrals. If you're in a country you're not familiar with what to do, or if you need to seek medical services, United Healthcare Global Assistance is there for you to give you the confidence to get into the care that you need while traveling. Yeah.
So I just want to jump in on one thing, just because we had this come up recently. So there's one just for the greater good comment I want to make on that. That very last sentence, if you flip back one. The global assistance when it comes to the active plan is really there to help our members. But the actual, if something happens, this is not the plan that pays for it. It's really the active health plan that pays for it under emergency services, because it's going to be an emergency when you're overseas. When that happens, as with all out-of-network benefits, the member needs to pay and then file a claim for reimbursement. If it's a situation where an air ambulance is needed, we do have a benefit for our retirees. When they're traveling overseas, it's a $25,000 benefit. Air ambulances in the last 3 instances that we've had have respectively cost $35,000, $49,000, and $54,000. I strongly advocate that if you are traveling overseas, that you get an American Express or go through United Healthcare Global, or I can't even think of who else has them. There's a ton of insurance carriers that have travel policies out there that cost pennies. While our plan will pay for it if something happens, most people cannot afford to put $25,000 to $55,000 on a credit card and wait for a claim to get reimbursed. It's come up so many times in the last 6 months that I now advocate that people who are actively employed and travel overseas get one of those really cheap travel benefits that's going to get you out of that country and back home again. We're happy to pay for the claims if it happens and you don't have one of those, but we have to pay for them after the fact, and that's a huge cash flow issue for people. So just wanted to make that point. It's just come up too many times this year.
Thank you, Andrea. Yeah, I mentioned as well, we do have a hearing care program through Amplifon. Provides access to their network discounts, much like the IMED program. This is a good resource for you to have discounted hearing care for hearing aids and other supplies throughout their network. And this eligibility, again, does also include extended family members, just like some of these other value-added benefits that come with your health care. Okay, here we go. All right. This concludes the benefits section. Then we have a few more administration pieces after this. And We've talked about open enrollment. You have your plans and rates in hand that just came off the press. So we'll skip that first date. This is the timeline for open enrollment. We're there now. Administrators have selected the plan. Members will receive a letter in mid-October specifying when you'll be able to go in and activate your open enrollment, when you'll be able to make your elections, and that is Diocese of New Jersey is in session 1, so disregard session 2. So between October 21st and November 8th is when you'll be able to go in and make your elections for your health care benefits for 2016. And at this point, we'll hand it back over to Andrea, talk about these topics, and then we have some administration topics that I'll cover, and we'll finish up.
I'm back. So I just want to, as we go thinking back over medical and some of the conversations that we had on the break as well. So I know a couple questions came up before we got up here related to opting out of the DHP. So I just want to go over a couple of things there. DHP, canon, 1,500 hours or more, clergy and lay, in the medical trust health plan, parity as of the end of this year in terms of what's contributed towards the benefits. So opting out, you're allowed to opt out, qualified opt-out, spousal or partner coverage, former employer coverage, TRICARE for life. The exchanges are only an option in a very, very, very limited set of circumstances. So there was a little bit of discussion during the tax presentation about those premium tax credits. It is a very, 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 very narrow group of people in the Episcopal Church who would qualify for those premium tax credits. And we do have information about that as well as an opt-out form on our website. But it gets around things of being at 400% of the federal poverty level and some things like that. So it's a really slim percentage of the population where the exchanges are actually a qualified opt-out to the denominational health plan. We recognize that there's not an enforcement mechanism for the denominational health plan. And so some folks may choose to ignore the mandate and to go to the exchanges. I would just ask that if that happens, that you be very, 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 very mindful of what you're purchasing on the exchanges. There are those narrow networks. They don't come with the additional benefits and services. They don't come with our call center and our advocacy and all the things that we bring to the benefits packages that you all have. It can, be a great cost benefit, but it can also be very shocking to the system what the real marketplace is like sometimes. So for folks that are non-qualified opt-outs, we just ask you to proceed with caution. Yes. I've heard of a couple. Yeah. We realize that, for some folks, we are not the cheapest game in town, but we do aim to really meet the unique needs of this church and of this population. We exist to serve you. We are a not-for-profit and really more, I think I was in a conversation with our CEO recently, and we referred to it as we're really a not-for-deficit organization. There is a little bit of surplus there, and the surplus is what helps us to deal with things like the transactional reinsurance fee under healthcare reform. We have to pay a little over $1 million a year for 3 years to offset any claims over $50,000 that are in sort of the marketplace for those uninsured who maybe are high risk where the insurance company didn't get it right. They came out to the marketplace with a really, really, really low rate. That's why you're reading in the paper of some exchange plans that are asking for 30, 40, 50% rate increases. It's because they didn't really evaluate the risk. And at the end of 2017, those government funds are going to go away, but we're responsible for paying them as a health plan. And so we've used our surplus to pay those fees under the Affordable Care Act. So there are some good benefits there, but just want to make sure that I give you the the total picture of things when it comes to the DHP and to the exchanges. So I'm going to talk a little bit about life insurance, disability coverage, education and wellness, and pension. I had the fortune to get over here a little bit early and heard some of your conversations, so I get the sense that you are all very well versed when it comes to pension and life. So I won't go into deep detail on those. We just have some slides here as a highlight. So on the life and disability side, there's the group life, the 311 plan, and the 9G plan. What you need to know there is one is part of the clergy pension plan, the other one is a buy-into plan. Supplemental life, voluntary life, disability, we have short-term and long-term disability programs. Right now they're with Unum. We will be announcing to the church, you guys get to hear news first because I'm here. We are going to be moving that relationship to Liberty Mutual come the beginning of the year. Liberty Mutual, I've talked a lot about our sort of working with other faith-based, with other church benefits plans. About 5 or 6 of the other large denominations are already with Liberty. They completely and totally understand the church population. They have a far more robust medical and clinical model. They have access to 180 physicians, and so they have a great orientation to return to work, and to, if someone can't return to work, helping them return to other ways to use their vocation that maybe aren't work, or other ways to help in their community, things to keep people viable and really feel like they can contribute. And so that will be happening, and you'll be hearing about that in the near future. On the education and wellness side, we have did we have a question in the back?
Is it possible yet to buy life insurance on
Spousal life? I apologize that I don't know the answer to that question. I am just learning life. So Jeff has been with CPG for 10 years, but he was on the publishing side until he joined us 4 months ago on the health plan side, or on the benefit side, I should say. I have been in health for 15 years, up until the last 4 months, where I am now also doing pension, life, and disability. So we will get an answer to that question and get it back to the folks here. Or if you want to just give us your name and email, we'll get an answer to that. On the education and wellness side, a lot of you are familiar with Credo, Planning for Tomorrow, Your Healthy Retirement, Steps to Wellness. We have a whole host of different on-site programs. We also have some information online. We are evolving and growing our web-based education and wellness programs. One of the things we've realized is that not all groups can afford to meet in this kind of setting where you can devote a day or 2 days to education and wellness. We've realized that people learn differently, and that some people, want to do it at 3 o'clock in the morning, and some people want to do it in a group setting, and some in an individual. So our education team is working extensively with our information technology folks and developing web-based programs for education and wellness. We also have a lot of great tools on our website, as do some of the partners who we work with. So Fidelity is an example. Tremendous amount of information out on their website. Calculators, things to help you plan for the future, things to assess where are you in your retirement readiness, where are you in your health. So lots of things out there in addition to our in-person work. So on the pension side, based off of your conversation earlier today, I think you all know you have a defined benefit plan. You also know that we offer defined contribution plans. When you look at the clergy and lay and you look at the numbers, if you remember back to Jeff's slide at the beginning with the wheels, the defined benefit clergy pension plan has been around since 1917. The lay benefit has only been around since 1980. So the clergy plan is a far more mature plan than the lay plan is. It has a lot more participation in it. On the defined contribution the RSVP is a great savings vehicle for clergy and lay who are in defined benefit plans. So as I said, for the last 4 months, I've been learning a lot about pension, life, and disability. And one thing that I keep hearing repeatedly is the value of that RSVP plan. So depending on how many years of service someone has, the defined benefit plan may not really be enough for you to live in the same level that you're accustomed to today into the future. The defined contribution plan is a great avenue for a clergy person or for a lay person to also work towards some additional savings in retirement. Our folks back at the office and on the education and wellness side are happy to talk through any of this life information, retirement planning. Kevin, Grace, Cheryl are all back there, and Larry as well from the Education and Wellness team, to get on the phone with you, to talk to you, to reach out to you, to meet you, to look at where you're at, look at where you need to be or where you want to be, and help you to figure out what the right vehicles are to do so. So definitely some great resources there to help you do some planning and evaluation of your savings for the future and of your retirement readiness. So this slide, very similar to the DHP slides, a lot of words on the page, but it really just speaks to the canon for the lay benefits, so that all domestic diocese parishes, missions, and other ecclesiastical institutions and bodies subject to the authority of the church are required to adhere to the canon. It has been in place since January of 2013, where lay employees who are scheduled to work 1,000 or more compensated hours per year are in the lay pension plan. So again, very similar to the first side. On the lay side, we've got both a DB and a DC plan. Defined contribution plans. Here's the big takeaway from this slide. Over in that first box where it says employer makes a defined contribution and an employee can also contribute, if your employer pays up to a certain percentage, try and have your contribution be at least up to that same percentage, so you're getting 1 for 1 on the dollar. You want to make your dollars work the most for you and to your benefit. So that's your big takeaway on this slide. The employee controls their investment decisions, and the employee's balance at retirement is really determined by what do they contribute and how successfully was it invested. On the defined benefit plan, the employer is putting money aside at a set percentage. The plan sponsor controls the investment decisions, and the employee's pension is based off of a formula regardless of what the performance of the investment is. So those are just to give a high-level overview, but again, based off of the earlier presentation, I think you all are well-versed in those benefits. So the next set of slides are really just information about our website, where information's available, more administrative in nature. So before we move into those, any questions on health benefits, life, pension, disability, things we didn't cover that you wanted to know? Yes? So I would have to go back and look at the sheet, but my guess is that the rates are calculated correctly. One of the things that we do in the medical trust when it comes to our pricing and our pricing actuaries is we look at the relative value of the plans. We also look at a bunch of other factors related to the administration of the plans. And so in all likelihood, if they're priced the same, it's either that their benefits are at a similar relative value or the combination of their benefits and how well the network performs in the given area. That's really discounts. How strong that is, and that is part of the formula that goes into the rate. So I do have a rate sheet in my bag here. I will double check and make sure they're the same rates, but
Exactly the same.
yeah.
Yeah,
Okay.
Yeah, just want to make sure that one reads something wrong with it.
Okay.
Normally, the other quick one is, and I don't know what the diet thought, on employer contributions towards premium. Are there any guidelines for that?
So the employer contributions towards premium are really in most cases set at the diocesan level, the Diocesan Compensation Committee. So I would leave, if there's questions about that, for your folks from the diocese to speak to those.
So I got past the buck, but it's really the benefits committee that does that. So currently, it's passed by diocesan convention that benefits are at 100%. There has been discussion of saying that those plans that are on the higher end, that if the clergy chooses to, none of this is set in stone yet, but what has been talked about is that if the clergy chooses to get that one, the church might say, well, we're going to pay at this level, and if you want the really high-end one, then you're going to have to pay the difference.
I think that was really our.
Yeah. So, I mean, and yeah, and
What the parish thinks is reasonable, the parish has to kick in that.
Right, I mean, and we're talking really the high-end ones, there's like 2 or 3 that are really at the end of it, so, there's been discussion about what's coming down the pike and cost sharing and that, but part of what, both the Benefits Committee and the Clergy Compensation Commission are very cognizant of is the difference between taxable income and benefits. And are somebody willing to give up some taxable income in order to get better benefits? And there's also an issue of making sure that we're attracting the best possible people to be clergy in our diocese. And we're actually at the low end in our area of what we put forward. So we want to still be able to be competitive within the clergy marketplace to make sure people want to come and serve in our wonderful diocese. So hopefully that answers your question. Okay. At this point, yes.
So I looked at the rate sheet and the rates are accurate. We knew you guys did them. We knew. So I just want to speak to that for a second. So the Cigna OAP in, which is the EPO, the in-network one, is the same price as the Aetna HMO. And yes, the Cigna OAP is less expensive than the HMO, and you are correct that normally the HMO is less expensive than the PPO. So there's a couple of factors at play. One of them also might be what the risk is that gravitates towards those individual plans, which could be a selection factor or a load that's on those rates. So I could go back and at the office be able to tell you exactly what it went into the formula. It is a little bit of an anomaly from what you'd actually normally expect, but it is what's right for your group. Yeah. Yeah. No, good. Thanks for checking. we like when you're paying attention. Okay. So Jeff's going to talk to you about the website.
Actually, what we have here for parishes, and I know, Pat, you're interested in this probably, and you've heard about it, Benefits Partnership Conference this spring. CPG actually has a complimentary service to put benefits information on parish websites or diocesan websites, and we have some examples I'll show here. I won't go into great detail of what this does, what it means, but the benefits information that's very helpful for all members to access can be accessed on a parish website or on a diocesan website. We have folks, Andy Shearer, who his contact information on here is our guru at this area, who will plant that information into a website and make it look like the look and feel of the website without looking clunky or coming in looking different. So let me show you what this looks like. But all this information here, how will this help you? It gives you a resource that benefits the employees with minimal effort to have that information at their fingertips. A lot of this information, all this information is also available at cpg.org. Of course, we love when you visit our website, but to have that information at the fingertips of the members on the parish website or the diocesan website is a wonderful feature. These are model pages. I know it's rather small, but St. James Church, Diocese of Alabama, and 2 more diocesan ones here, Virginia and West Texas are using this. You'll see that they have sections that show, click through to different benefits and explanation of those benefits. And you can see here how the design of that matches the motif or design that the website already has in place. I mentioned Andy Shearer. Andrew Shearer right here, Director of Web Strategy, if you'd like to take advantage of this. I know I heard vestry in the room, treasurers, Pat, Parish Administrator, Rector over here with Jane. Please take down this information. Again, the slideshow will be available, or we can get you in touch with the folks as well to get this service. But I think it's wonderful, it's free, and anything free is wonderful. Administrators Resource Center, this narrows down the audience a little bit, but again, Pat, you work with this, and Dixon, Janice, you work with this as well. This is primarily for parish administrators or diocesan benefits administrators. CPG.org has a section for administrators. Of course, CPG.org has sections for lay and clergy. We all have something there. but specifically for administrators to access the information. So this is a good FYI for all to see that our administrators have these tools available online, and what's not there is sometimes here or with my colleagues like Andrea. And again, it's a central place for administrators that provides how-to information, all the updates that we have when we put out new information that comes out across healthcare industry. We populate that onto the ARC, the Administrators Resource Center. We've done a few questions and answers. At a glance contact list, again, it's kind of small. There's numbers there for each of the different divisions of CPG, so this will be available in the slideshow online. And this is how to contact client services. Now this is your first point of contact if you have questions over your coverage. As members, you can contact client services directly. We have people across the country in all time zones working in client services. Therefore, we're open from 8:30 a.m. Eastern to 8 p.m. Eastern on that 800 number and email address there. And then our website, cpg.org, available all the time. And then we'll close out ours, then I have another guest to introduce to you, and we'll make sure if you have any more questions for us after we leave this slide. But again, thanks for inviting us here today. We've really had a good time presenting to you, working with you. And as it says, we want to build strong partnerships, and we are here to serve you. That's our job. My job as a relationship manager to the diocese is to ensure that the members have what we all need from the pension group. And another thank you. Any questions for myself or Andrea before we hand it over to John Pollock, who's here to talk about long-term care? Any other questions for CPG? Okay. All right, we'll invite John Pollock. This closes out CPG, and John Pollock is here to talk about his services with long-term care.
I know you've all had a long day. Basically, I was just asked to come and introduce myself. I'm John Pollock. I've been doing long-term care insurance for about 23 years now. I deal with all the different carriers, with all the different products, and as you went through all your medical benefits and disability and life, one thing that's not covered by any of those is long-term care. And as the population continues to age, and I'm sure you see people that need care in their own home, assisted living, continuing care communities, life care communities, and nursing facilities, this is a very expensive cost, and a lot of people choose to look for insurance to cover this. I work individually, so basically what we do is we sit down, go over your specific situation, and see what the best match would be. There are a lot of different companies, or a lot of different policies, there's a lot of different ways to accomplish covering this type of exposure. What's the best for you is just a matter of sitting down and figuring it out. There's a lot of questions. I'm happy to take any question that anybody have right now. I'll stay here for a couple minutes, but I know it's a long day, so I just wanted to introduce myself. For those that are interested in learning more about long-term care insurance, we would sit down individually. It's not something that we're going to spend 45 minutes going through today. Okay? No questions? You're going to let me off that easy? Okay. Yes. Somebody want to tackle that for me?
I don't know the answer to that one. So I know the church pension, we, a long time ago, had a long-term care policy. I don't believe we do anymore. So we could take that as a question of, is housing in any way connected to long-term care? We'll take that back as a question.
I have a card. I'll give it to you. You'll be able to contact me directly. Yes?
How much is enough?
What I like to do is cover the majority of the exposure. Nobody has a crystal ball. What we like to think is that in the future that we'd like to be cared for either in our own home or assisted living facility. So what I try to do is look at the going rate of those type of facilities in your area and match up about 75% and try to cover the bulk of the exposure.
So what do you usually do, like 20 years, 30
Okay, the policies have changed over my 23 years, especially in the last 8 to 10 years, where the policies would cover you indefinitely. So if you needed care, you would cover you indefinitely. Now most of the companies have limited their policies to 5, 6, 7 years, okay, from the time that you need care. Which, what's happening is we're all living longer. And that's great, and more people need care than ever, which isn't good. But that being said, there are less long stays because of the better medications and procedures. We're keeping people alive longer, and we're also keeping people healthy longer. So more people are needing care, less long stays, so that's why the companies have gone to that and a bunch of other reasons, but that's why the companies have gone away from lifetime benefits.
You get dementia patients that just hang on for a than 100.
Well, yeah, and what we're seeing, that used to be an 8-year stay on an average, and now with medications like Aricept and some other things, we see that you're still going to end up here at, let's say, 100 if you get Alzheimer's at 85, but rather than gradually, with the medications, it's more quicker, so you only need care less. So that's the way it's going, and with procedures, hopefully that will improve. Yes?
If one got long-term care insurance, say in 2004,
Okay.
should I look at that again, or is it pretty good that I got it through Prudential, through the church pension actually?
Chances are it's pretty good, but what I do offer is to sit down, or at least you can email me or scan or fax or whatever technology we can do to look at it so I can explain it to you. Because what I find the most valuable thing for a lot of my clients is just sitting down, going over what you have, because it was back in, what'd you say, 04?
Yeah, back
04, when you purchased it, that's 12 years now, 10, 12 years. You probably aren't that familiar with what you have. Chances are we don't want to replace it. You were very proactive, you got it, you were younger and healthier then, most likely. So we're going to keep what you have, but it may behoove you to call me just so we can give you a summary of what you have, if you want, okay? But I'm not a big habit of switching policies because you're older, and the older you get, the more expensive it gets. That's why my average client, which used to be 65 years old, is now about 54 years old. So
that's where I was.
right, so you were,
Church pension said,
yeah, they were,
this is the best time
right.
for expense-wise.
And I think what's happened, a lot of the companies that I come in with, when I say companies like organizations like that, it's tough in this world to be married to one company because there's not really one good situation for everybody. So when they use Prudential, Prudential's a great company and they're going to pay the claims and it's great, but they've decided to leave the market and this company's gotten into. So what happens is it's hard to be married to one carrier. That's why a lot of the organizations have moved away from having that as a piece of the puzzle, where I can go in and say, these are the 20 companies that do what you're doing, let's find the best situation. Does that make sense? Any other questions? Yes. Yeah, I have some cards. I'm going to stay for a couple minutes. You see, I was smart. I came a little late, so I'm not as tired. I know you guys have had a long day. So I'm going to just leave, but I'm here afterwards for questions, and I have cards, and I'll be able to contact you individually. Thank you.
Having sat with John recently and gone through the insurance quagmire with him, I can vouch for the fact that he's one of the clearest presenters on that quagmire that I've ever heard. So he's a great resource and came to us through Dixon. So thank you for being here today. Dixon, do you have anything you need to? Okay, good. And he's available afterwards if you have any questions for him. And I think Valerie has one more thing.
Specifically for clergy, this is very important. Once again, your personal information summary. Some of the other information that included on here, it says pre-retirement survivor benefit and who you've listed as your beneficiary, your lump sum death benefit beneficiary, and it's listed there. If you want to change those at any time for whatever reason, those change forms are up on the CPG website. Those are 2 forms. There's more, because that doesn't include life insurance from CPG or the life insurance policy through the diocese. Those are 2 more forms that you need to know in order to fill out of who your beneficiaries are. It's really important that you keep that stuff up to date. I need to change mine, and this just reminded me that, because I made the mistake of making my estate the beneficiary, which isn't helpful. If it goes to a person, it's not necessarily taxed. If it goes to the estate, it may be taxed. So these are things that you get these information from Church Pension Fund. They're helpful and good reminders, and we have to be our own police people to remember to look at our benefits, make sure, number one, that they're paid and that they're accurate, because they will affect what you're, hopefully what you're gonna get when you retire. So part of what we wanted to do at this conference or this day was to really help people understand what their responsibilities are and how to make sure that the accurate information they have is as accurate as possible.
And also mention that the salary, the past few years is on there, so if there's anything that's wrong, CPG needs to be notified.
Yes, so there's a list, it has here of my 7 highest years of, I've been at this for 10 years, so it's essentially the last 7 years that says what my hack is. Hack is highest average compensation. And if any of those numbers are incorrect, or you believe they're incorrect, you have the opportunity to fix them, but there is a time window limit on that, so you really do have to be up to date on when that is.